And so when we talk about kids and sleep apnea, since that's really what you guys have been learning for the last couple of weeks, how does facial growth apply to it? And so there's a great research article that showed pediatric sleep apnea in non-obese children is a disorder of oral facial growth. So if we look at it and say, how is that any different than adults? If our face doesn't grow into the place it is, we're not going to have the proper airway size. We have to be able to make sure that airway grows into the right position. So when we start talking about sleep apnea in children, it's different than when we talk about it in adults. In adults, I know Dr. Bennett's, they both went over, you have to have at least 5 events an hour to be considered mild apnea, right? In children, it is way more sensitive. If you have even 1 event an hour, that is considered diagnostic for mild sleep apnea. And so this is where we use totally different scales. And the reason is that kids are growing and developing. And so this is where we have to talk about what's happening to kids during sleep. So if they have at least 1 event, but up to and under 5 events an hour, they'd be mild. If they have between 5 and 15 events an hour, they're going to be in the moderate category. And anything over 10, 5 to 10 events an hour is moderate, and anything over 10 events an hour is severe for a kid. I mean, even at 10 events an hour, if it was an adult, we'd say that's still mild apnea. But for a kid, that is super disruptive to their sleep. Kids get different symptoms than we get as adults, okay? Growth hormone is released in that stage 3-4 sleep. If they are not able to get that proper stage of sleep, they're not going to get that growth hormone. So when we see kids who have sleep apnea, we oftentimes see that they are not developing physically as much as they are supposed to. They're small kids. There is a decrease in IQ scores for kids who have sleep apnea that is untreated. I think I've heard up to 10 points in IQ drop as a result of untreated apnea in children. If their brain is not developing because they're not getting the growth hormone, it's not going to develop to the position it's supposed to. In kids, what happens to them when they're that age is going to affect them for the rest of their life, even if that is eliminated later on. If they don't get that critical development in that critical time, they are not going to be the same person that they could have been if they had the airway, if they were sleeping at that stage of life.